Good morning and welcome to our webinar about Sentara Health Plans, how to make the most of your benefits. And we have some exciting news to share with you today about some of your benefits that the city's offered you and how to take advantage of them. My name is Bill Sloan. I'm the Director of Case Management with Sentara Health Plans. And before we jump in, we'll get started with a few ground rules. Few housekeeping items. Please, this presentation is recorded for future playback. So please do mute your microphones and turn off cameras. Place any questions in the chat and they will be addressed at the end of the presentation. For personal questions, we ask in order to maintain privacy, please do not ask personal questions. Instead, there's a phone number here, 1-866-503-2730. Please contact that number and we'll have a case manager assist you with your personal question. Now jumping into the content. What do we do? What is clinical care services and what is case management? You may hear these terms out there and really wonder, what is a case manager and what does a case manager do? Well, we use this quintuple aim, and the quintuple aim was developed by the Institute for Healthcare Improvement, and they've given us a guiding framework of how to help improve health outcomes. And so that's the framework that we use to really try to move health outcomes into a positive, healthier manner. And that includes lifestyle management and stuff. So first, we have better outcomes. This is where we're looking at the very specific health outcomes and how can we improve those metrics? How can we make the individual a healthier person? Improve patient experience. So that's around the usability of your plan and of the health care that you receive. Health equity. We know that there's other factors that impact health. Arguably, some of these factors are more impactful than the healthcare itself. And so with health equity, we're looking at things like financial barriers and transportation, all of those things that go into accessing your healthcare, not just healthcare, but leading a healthy life. How do we lower your cost and ensure that you are still receiving the best care possible, but at the most affordable cost, partly also reducing that barrier that goes along with health equity of the financial cost, and improving the clinician experience. And we focus on improving the clinician experience because we want the providers to be able to have the most seamless experience possible and work in a network that is fully integrated, because integrated networks lead to better health outcomes. So how do we do this? Sentara Health Plans is part of an integrated delivery network, and that's comprised of the health plan and Sentara Health being our provider arm of the organization. So clinical care services is our case management department. It's made up of both clinical, non-clinical team members providing inclusive care. And we really use an enterprise case management and model. So what does that mean? These are kind of some big words, generic words. And essentially, when we're looking at case management, we're looking at how do we as clinicians work with our members to coordinate all of the different services. Care can be complex. We know that it can be difficult to navigate. And so the benefit of a care management or a case management team is to have someone that can advocate for you, someone that can help you when you're not sure where to go, or you might need some additional education. You may not even know that you have a need. So we do an exhaustive screening to determine what everyone's needs are. And really with the idea of promoting a healthy response or a healthy outcome. And we want everyone to live the longest, fullest life possible. And with that, we have an emphasis on preventative care. And with preventive care and preventive treatments, the focus is on moving the needle closest to the most appropriate site of care. The best site of care, the most appropriate site of care, the most appropriate treatment at that time is something that's going to not just improve clinical outcomes for each individual member, but it's also, we want to reduce any potential for negative side effects or negative impacts from over-treatment. So we're really focusing on the right level of treatment, not under-treatment and not over-treatment. And how do we promote our benefits and programs, not just within the health plan, but also giving you access to our community resources that are available to you? So we do that through our clinical model. We have our member services team that also assists with some of the more non-clinical information, like checking authorizations, checking if you have any claims or payment issues. And it may not just be an issue, it could just be questions. You may need assistance finding a provider, or may have a question about your benefit, what it includes. Member services is a great team member to help you with that. We have our Sentara Health arm, which includes our Sequin provider network. Again, a fully integrated network that's based on quality of care. And when we combine all of that together, that's how we meet our members' needs, with the goal of a one-call resolution, reducing and eliminating confusion, and saving you time, money, and frustration. So which programs do we have? We have several clinical programs available to you, and the city has been very great and involved in ensuring that you have a very comprehensive program available to you as employees. So first off, we have behavioral health. So we have a behavioral health program to assist with any of those needs that includes substance use and our more traditional behavioral or mental health model. NICU management. So for those that are pregnant and maybe you have a baby and the baby needs to go to the neonatal intensive care unit or the NICU, we have a dedicated team of clinicians to support those mothers and the baby, specifically for the baby while they're in NICU and even after discharge. Oncology or cancer management. This is another big area, very complex needs and a lot of things that are out of the normal realm of what do I do? We have a team dedicated to assist our members with oncology management. Similarly, rare condition management. We'll get into each of these a little bit more into more detail, but rare condition, you can think of things like sickle cell anemia, for example, would be a rare condition, or Crohn's disease. Transplant case management. We have a team that assists all the way from the pre-transplant, from the time of identification of needing a transplant, all the way through 1 year post-transplant. And what's important to know is even if you don't fall in that time frame, we have people that will help you regardless of whether or not you fit into that program. And then we have our chronic condition management, which is going to be several other conditions, and we'll get into those specifically here in a minute. So jumping into our chronic conditions in pregnancy, we'll start with our chronic condition programs that I just mentioned. So we do have programs, dedicated programs for diabetes and cardiovascular health, which is defined as coronary artery disease and congestive heart failure, respiratory, defined as asthma and COPD, or chronic obstructive pulmonary disorder. We have rare conditions management program, and then our partners in pregnancy program for the mothers to be, and the baby for the first year of life. Again, it's worth noting that if someone feels that they need assistance with a case manager, you don't need to fit into any of these programs to reach out. We will case manage any member with us, regardless of whether or not you fit into these programs. But these are dedicated programs that we do have for you. So if you do have one of these conditions, we're here to help you make the best of that condition and improve that health outcome and improve your overall quality of life. But again, you do not have to fit into any of these programs to participate. So we're going to move into program eligibility. And so this eligibility is largely with our incentive programs. Again, regardless of whether or not you participate in the incentive is receiving a reward for participating in the program and achieving the certain milestones. Anyone can participate in the overall case management program now. So first is our eligibility for City of Virginia Beach employees. Must be a full-time employee enrolled in a City of Virginia Beach plan through Sentara Health Plans. For our Virginia Beach City Public Schools, full-time and full-time equivalent employees enrolled in the VBCPS plan through Sentara Health Plans. Retirees are eligible. And for retirees, you must be enrolled in either the City of Virginia Beach or the City Public Schools plan through the health plan. Not eligible for incentive or points would be the part-time or temporary employees, and spouses and dependents. Okay. So now we're going to move into case management.
Excuse me, Bill.
Yes.
Just a quick question on the retirement. So is it the same benefits as I have right now as a, city employee? It's not retired?
As far as the incentive goes?
Like the medical benefits and that kind of stuff? If I'm retired and I find out I have prostate cancer, for example.
So you're asking about your general overall benefits, if there's the same for an active employee versus a retired employee?
Yes, sir.
That would be an HR question to see exactly how the flow is for the different benefit structures, offerings for retirees versus non-retirees. We can answer the question from the services that are provided that are covered, but just not necessarily what is specific for retirees and non-retirees for their for their health plan offerings.
Okay, sorry to digress, Bill. Thanks.
Thank you, Tamika, for jumping in. So we're going to talk about our case management program here. We're going to talk about our program criteria for each program, our kind of what you have to do. So for pretty much all of these programs, we have some program specific criteria. We have a treatment plan and medication plan that's between the patient and their provider. It's following that agreed upon plan of what you and your doctor have agreed to. following a nutrition and exercise plan, obtaining required labs and exams, and talking with your case manager. So now we're going to jump. These are the core tenets of case management and the incentive programs. We're going to jump into each specific program now, though. And so for diabetes management, the incentive for this program is, and this is a huge incentive, is a copay waiver or a copay reduction for diabetes. And that is for people that complete the program for January 1st through June 30th, receive that copay reduction on August 1st. If you complete in the second half of the year, then that copay reduction gets turned on in February instead. In addition to a copay waiver, which, like I said, is a huge incentive, that's a huge reward, and really helps a lot with any kind of financial barriers, especially. You can also get up to 3,000 B-Well points semi-annually for being successful in that program. So what does success look like? For the diabetes program, it's active treatment for diabetes. It's enrolling in the program, speaking with your case manager each quarter, being every 3 months, taking your medications as prescribed, visiting your provider or your primary care once a year, receiving an A1C test twice in the year, once during the first half of the year and once during the second half of the year. And we have a few more labs that are required here, being a urine microalbumin test and an LDL cholesterol test that are both completed annually. A dilated eye exam, again, completed annually. Foot exam provided by your doctor annually, and then development of diabetes management plan that includes an activity and nutrition plan. This is something the case manager will help you with. So why do we have all of these things, for diabetes? And that's because diabetes affects pretty much every system in your body. And so we're monitoring the progression of the condition and trying to keep you as stable as possible and really trying to prevent the progression. But then we're also looking for any potential side effects, and we want to intervene as early as possible if you were to have any issue. Cardiovascular management. The dates are going to be the same as diabetes. So if you complete it during the first half, you'll receive 3,000 B-Well points in July. For the second half, you'll receive those 3,000 B-Well points in January, the following January. So very similar, we're looking at active treatment for CAD, being coronary artery disease, or congestive heart failure, CHF. Requirements include enrolling in the program, speaking with a case manager, again, every quarter or once every 3 months, taking your medications as prescribed, an annual provider visit or physician visit, receiving lab work that includes an LDL cholesterol test annually, and then also having a blood pressure completed annually by your provider. And we also, like I said, with diabetes, we have the activity and nutrition management plan that is part of that. Respiratory management, again, with COPD and asthma, you can receive up to 3,000 B-Well points. Same time frame. First half of the year is awarded in January. Second half of the year awarded in, first half of the year awarded in July, and the second half of the year awarded in January. So this is COPD and asthma. We're looking again at enrollment in the program, speaking with your case manager every 3 months, taking your medications and seeing the the provider once a year, receiving an annual flu shot, and then again, asthma or activity and nutrition. Activity and nutrition being a cornerstone of every program we have because it promotes a healthy lifestyle. Rare condition management. Similar reward structure, earning 3,000 Be Well points for the first half of the year in July and the second half of the year in January. The criteria for this requires active treatment for a rare condition. Examples of that rare condition are sickle cell, Crohn's, hemophilia, epilepsy. We have several others as well that are included in that. And we do have flyers for each of these programs available on the website, or I should say on the Virginia Beach website. So completion criteria, enrollment in the program, and speaking with a case manager at least every 6 months. So this is twice a year. Recommended actions being taken medications as prescribed, and then ensuring that you go see a primary care or specialist annually to help maintain and manage that condition. And pregnancy. So very exciting time, expanding the family and having children. You can earn up to 3,000 Be Well points for participating in this program. This program isn't just for first-time mothers. This program, every pregnancy is different, and this program is to give you a resource to help you advocate and navigate the healthcare system and really be that voice for you and give you different information or as things come up, often their first time experiences, and having someone that's in your corner to help you manage that situation. And the ultimate goal of this is to have a healthy mother and a healthy baby. So our program goals are maintaining good health throughout the pregnancy, developing a nutrition and activity plan for optimal goals, maximizing your benefits and resources. We can help you with community resources, locate classes and services and other resources that may be available that fit within the confines of how you wish for your birth plan to look. Coordinating prenatal care and appropriate risk screenings, so that you then know what kind of actions that are needed to be taken to have, again, that healthy mother, healthy baby. Understanding healthy tips. We'll actually mail these directly to your home, so that you receive these and you're getting timely tips sent to you. In order to participate in the incentive, you must enroll in the first trimester of your pregnancy, which is the first 3 months. See your obstetrician or the OB physician within the first 3 months of your pregnancy. Speak with your case manager monthly upon enrollment. We'll help you develop a nutrition and activity plan. And then also receiving that important postpartum visit within 6 weeks after delivery. Yeah. So additional assistance we can provide for you. And remember, the incentives are only for the previous conditions that we spoke about, but we will help you case manage any condition you have. But if you need case management assistance, here's a couple situations that may apply. Maybe you don't understand a diagnosis, medication, or treatment plan. You have a question related to something. You were recently discharged from a hospital or an emergency department. You have questions, or maybe you don't have everything set up like you thought you had. oftentimes when we're in the hospital, we're sick, we're not feeling well. We may not understand everything or remember everything that was told to us, and we can help you with that. If you need assistance obtaining equipment, again, this is especially true after an injury or a hospitalization, even an ED visit. You require assistance to achieve a health goal. You've decided that you want to do something to become healthier and improve that quality of life and the longevity of your life, which is so important. We're here to help you with those, and you don't have to be part of an incentive program for us to help you with that. All right, so how does enrollment work? So our members will automatically be enrolled in the diabetes, cardiac, and respiratory programs at the beginning of each year. We'll send you a letter annually and as you qualify for enrollment. So if you didn't have the condition at the beginning of the year, but you have it later on in the year, we'll send you a letter if you qualify after that point. And that can occur throughout the year. And so we send those letters quarterly. You can contact our case management team to request enrollment in any program. This is especially true with Partners in Pregnancy and our Rare Conditions program. And the reason that is a little more true with these is, anything can happen at any point in time, but pregnancy is a little more time limited as far as that goes. So if you find out you're pregnant, give us a call so that we can start engaging with you immediately and helping you through that process. And again, that exciting time of life. So we're going to talk about program expectations. First off, our program is completely voluntary. So that includes both condition management and the wellness program. There is no negative repercussion for participating in that program with us. All Sentara Health Plans are eligible to participate in case management. And as we've seen with some of our programs, you may earn points for participation. Now, we have a few other programs and resources available for you. We have monthly webinars and on-demand videos. On the SentaraHealthPlans.com website, you can find all kinds of information of how to maintain your health. In addition to that, you have personified health as a wellness option, and you'll receive information about that from your Be Well team. Please note that Be Well points are not awarded for attending these webinars. So the on-demand presentations and audios, we have a link here, and that's SentaraHealthPlans.com/healthy on demand. And these live webinars occur on the third Wednesday of every month. We have self-paced at-home programs. These are award-winning programs, and they're designed to help you with your particular need, from whether that's tobacco cessation education, where we have a library of videos and printable materials for you. We have chronic disease prevention, such as type 2 diabetes and some of the other conditions that we've discussed today. Movement and fitness programs, being Move About, yoga, Tai Chi. These are all important things. A healthy lifestyle is the number one thing we can do to prevent or slow the progression of a chronic condition. We have guided meditation libraries to help you with, experience that calm, peaceful retreat. Those everyday stressors that we all have, and being able to de-stress and kind of process that day productive manner, and really promoting, mental health and mental wellness, especially. Nutrition education. We have educational programs to help make healthy food choices at the grocery store and in meal planning. And then stress management and better sleep programs. Again, back to mental health and mental wellness, encouraging the, the very beginning of your day, starting with a good sleep program and good sleep habits that then can help you produce good stress management techniques as well, and the combination of the two together, and then de-stressing with some meditation, really to promote that full health, mental health and wellness package. So how can you make the most out of your health plan? First, we want you to get the biggest bang for your buck. And that includes participating in case management programs. These programs are designed they're all evidence-based. They're designed to help you, if you have a condition, keep that condition under control, and hopefully even maybe slow the progression or go, reverse the progress even of a condition. And so that's going to be one of the big pieces we have, especially for our chronic conditions. We also, like I said, will help you advocate for your health and provide those resources and kind of guide you. We also have MD Live, which is a virtual option for minor illnesses. This is a great web-based virtual. There's an app for any kind of minor illness. Maybe you can't get into the doctor. Maybe your availability doesn't work, or even in the middle of the night. What MD Live is great. I've used it a couple times, and it's super convenient. You kind of go on, and you might just have something that comes up in life and throws you a little bit of a curveball, and maybe you don't feel like you want to go to the doctor, but you are willing to do a virtual visit and kind of get control of that. Next, we have our Sequin network. We're part of an integrated delivery network. So Sequin's our Sentara Quality Care Network. And this is where we really see the biggest bang for our buck. And that is, you're in a full ecosystem with Sentara Health Plans and the Sentara network and the Sentara providers, and working together. That's how we're going to help you get your maximal health outcome. Using preventative care benefits, they're free. There's not just they're free, but preventative care is designed to identify any conditions as early as possible, and also prevent you if we're not able to, or if we either identify it early, or we may be able to prevent you from getting sick, and promoting a life of wellness instead of a life of sickness. And then using generic medications as much as possible. Generic medications are often the same medication as the brand name. It's the same active ingredients, but they do cost much less than brand names. We're going to move into contact information, and then we'll take a look into the chat in just a moment for questions. So here's our contact information to reach the case management or chronic condition management team. You can call 1-866-503-2730, or you can email myplanrewards@sentara.com. Partners in pregnancy can be reached at 1-866-239-0618, or you can email pregnancypartner@sentara.com. then your Be Well team, great team of resources for all of your benefits. You can call 757-263-1060 or email bewell@vbschools.com.